Hello and welcome to this podcast. Today I'd like to talk about regional working, I'd like to talk about waiting times, and I'd like to talk about the electronic patient record. Now, regional working isn't new to us here in NHS Grampian, and for many years we've worked across health board boundaries with neighbouring boards and boards covering the islands of Scotland. Things have taken a step forward in recent months, and I've been appointed by the Scottish Government as the Regional Chief Executive Implementation Lead for the 6 health boards covering the north of Scotland. This is a substantial additional commitment. I'll be working with the other 5 Chief Executives, working across the 6 NHS boards, looking to see how we implement the National Delivery Plan for Health and Social Care, and how we gain greater sustainability of services from a workforce point of view, from a clinical service point of view, and also from a financial point of view. The role reports to the Director General for Health and Social Care at Scottish Government and is very much focused around patients and services and quality and safety and sustainability. So how we make sure that our patients, not only in Grampian but across the whole of the north of Scotland, get high quality, safe, reliable services is exactly what this is about. It's also about building stronger partnerships. It's about building stronger partnerships with the other 5 NHS boards. It's about building stronger partnerships with our local authorities. It's about building stronger partnerships with the third sector as well, and how, if we work together in a much more consistent manner, we can deliver higher quality of services which are much more sustainable for our population in the future. I'd like to talk about our waiting times for elective surgical treatment here in Grampian Health Board. Since the beginning of the year, we've had some real challenges in that the demand for services is exceeding our ability to provide those services. And what we've done is a number of things, including being really clear with our public, with referring GPs, with clinicians, that we really should be treating the most urgent patients in the order of their clinical needs. And this is something we've been working very closely with our clinicians about, and also being very clear with our referring GPs and also with the wider population. And not only are we doing that, we're seeking to redesign and improve the services that we've got. So our surgical transformation program has been really important with regard to this. All of the work that's going on in our operating theatres, in our critical care beds, in our ward capacity, making sure that we use to maximum effect the resources that we've got, and instituting new opportunities such as day of surgery unit, which we're just piloting, and making sure that patients who need day case surgery get day case surgery rather than inpatient surgery. We're also working really closely with our education providers to make sure that we get trained staff into our workforce to try and make this the most attractive place we can as possible for people to come and work, and putting in place things like return to practice programs and a whole range of other initiatives to make sure that we get the trained workforce that we need. So there's a range of initiatives going forward here. And I just want to commend the work of all of the staff who've been involved in taking this forward. And I think at the heart of it, what we want to do is to be open, honest and transparent with everyone about what the current situation is, but also to make sure that we will treat patients in the order of the clinical priority, and we will always put quality and safety and improvement at the heart of what we do. Still on the subject of engaging with patients, the new national complaints procedures have come into effect, and this is really important, and there's a big emphasis in the new procedures on early resolution. And I think that the more that we can do to resolve complaints or concerns or issues that have raised right at the interface between the member of staff and the patient. And if we need to give an apology, then we should give one. If we need to give reassurance, then we should give that as well, and to try and resolve as many of the issues that are raised at the time with the patients and families and relatives as possible. We've now also got the facility to make sure that where any of these issues are raised, they can be recorded on Datex, and that is important too, so that that information is collated and we can find out what the trends are and what the things we need to do as an organisation to further improve our services and to try and develop in a very person-centred way, and that's what really all of this is about. I'd like to move on to the electronic patient record, and 2017 and 2018 are already seeing and will see some really big developments in the setting up of the electronic patient record. This is going to be really important to us, not just moving away from a paper-based system, but moving to a system where all of the information concerning patients is on an electronic patient record. And it's going to help us in the future as we use technology to treat patients who are maybe far away, using technology such as telemedicine and video conferencing, and making sure that all of the relevant information is available to clinicians who are treating patients when they come into our facilities and services. Outpatient services within Aberdeen Royal Infirmary are moving firmly towards the electronic patient record. We'll be moving out a lot of paper-based records into off-site storage from our basement area and increasingly relying on our electronic patient record in the future. And I'd really just like to thank and commend all staff within outpatient services for all the work that's been done and getting through some of the teething troubles and getting used to working in an electronic way rather than a paper-based way, and on the basis of this I think we're making some absolutely fantastic progress in this regard. Looking further ahead, we're very much looking towards introducing electronic prescribing into our hospitals and services in 2019 and 20, and this will be available right the way across the north of Scotland, which again will lead to some real improvements in patient safety and in reliability and the whole area of medication safety, which is one of our top concerns. So this programme is rolling out and I think will be of great benefit to both patients as well as to staff who are treating those patients. Meanwhile, we've got a very extensive programme of building work going on across NHS Grampian. It's really great to see the new Inverurie Health Centre and Hospital and Hub being built, and that's going to bring us some fantastic facilities for Inverurie. It's good to see the new Forester Hill Health Centre going up on the Forester Hill campus, and work is well underway on that. And it's also good to see as well the patient car park that was funded by Sir Ian Wood and Lady Wood, and that's going to be a fantastic development for our patients. So a lot of building work going on. There's a number of other projects as well that are equally important but slightly less obvious. So as part of the Carbon Energy Fund, for example, we've entered into a 25-year contract, and you'll see some of the building works going on now, to join up the Forester Hill campus with the Cornhill campus, giving hot water and steam to the Cornhill campus. And again, that will create a lot of benefit in terms of our carbon footprint, but will also help to release some significant financial savings in the years to come. And of course, we never work in isolation here in NHS Grampian. National and international events do impact upon us, as do elections. The recent cyber attack affected some of our facilities, and again I'd like to commend the staff who responded to that so swiftly and so professionally. And terrorist related incidents in other parts of the United Kingdom also meant a move to critical status here in Scotland, and again I'd just like to thank all of the staff who were involved in the preparations for that, which led to a very professional and interagency response to some of these threats. So Grampian works very closely with its public service partners, both nationally and locally, and these are some examples of where we've done that. So all of these events really draw down to the point of safety, which is the key priority for us in NHS Grampian. And I think the response of staff to some of the incidents that I've talked about, I think, has been absolutely magnificent. I really appreciate the way staff come together in multidisciplinary and multi-professional teams to look at risks, to look at challenges, and to manage those in a very effective and professional manner. And at NHS Grampian too, we seek to reach out to our partners, so our working with the police, with the fire and rescue service, with our local authority partners, are working with our 2 universities and our College of Further Education, are working with the third sector, and our volunteers are all incredibly important to us. And finally, and very importantly, the ongoing working relationships we've got with staff and our partnership working here in Grampian, I think, is absolutely first rate. So all of these things that I've talked about today are significant challenges for our system, but by working together and working in partnership and working across boundaries, I am absolutely convinced that we can work through these challenges and we can deliver high quality, safe, effective services for our resident population who really need them. So in ending this podcast, once again, thank you to all of the staff who are providing these services. I think, we are doing a fantastic job for our resident population, and we've got a really good health service here in the NHS in Grampian. So thank you very much indeed.